So we have people trapped in opioid addiction for years. And our system's answer is usually this. Here's another opioid. Take it every day. Forever. Methadone, Suboxone, maintenance, management. And look, I have nothing against harm reduction. But at some point we have to ask, is the goal to help keep people alive or is it to help them become free? Because Ibogaine is different.
It is a non-patentable plant molecule that doesn't have the regular incentives attached to it for a conventional pharmaceutical company to take it through the drug development process. It is anti-addictive, meaning somebody who is addicted to opioids can take Ibogaine and virtually overnight they will no longer have that physical addiction, nor will they have the withdrawal symptoms. As opposed to the drugs in the opioid racket, as I call them, drugs like Suboxone and methadone, helpful in their own ways, but you have to take those every single day. There is a profit model to taking a drug every single day, as opposed to something that you can take just once and you won't have to take anything anymore. Ibogaine also is misscheduled as a Schedule 1 drug. Schedule 1 means that it has no medical value and it has a high rate of abuse. Ibogaine, we use it to treat traumatic brain injury. We were the site of the Stanford study that happened a few years ago. 30 U.S. Special Forces veterans went to Stanford prior to coming to our company, Ambio Life Sciences. They had brain scans before and after the treatment. The pre-brain scans clearly showing traumatic brain injury, post-brain scans showing it was largely reversed, if not entirely reversed in a lot of those guys. We've been seeing great results with Parkinson's disease, multiple sclerosis, depression, anxiety, lack of purpose, lack of meaning, that constellation of symptoms that veterans might call operator syndrome. Plus, it's incredibly anti-addictive. So the rate of abuse is next to nil. Nobody enjoys taking Ibogaine, and they tend to stop being addicted to all the other substances they were hooked on after taking Ibogaine.
It doesn't just numb the withdrawal. It doesn't replace one dependency for another. It literally interrupts the cycle.
Ibogaine has the unique ability to restore the brain's dopamine and serotonin production to its pre-opioid exposure levels within 36 to 48 hours, thereby fully resolving physiological opioid dependence with a single administration for 80% of individuals the first time. That number goes to 97% with a second supportive dose. Wow. It is extraordinary, especially when we consider the outcomes that are produced by our existing treatment system. Addiction currently, you have two pathways. One is abstinence only, and the other is what's called medication for opioid use disorder, or what I refer to as opioid maintenance treatment. Outcomes associated with abstinence treatment are essentially a rate of success of 7%. And the reason for that is because it takes the brain 18 months of complete abstinence from opioids to recover its own individual dopamine and serotonin production. You have to be completely abstinent for 18 months before the brain begins to heal. Ibogaine shortens that to 48 hours. It is something that is not understood, but is concrete and real.
People describe it like being forced to face things that they've been running from for years and somehow coming out of it with the volume turned down, withdrawals and cravings completely reduced, trauma brought up to the surface instead of buried under another prescription. And now we have Texas stepping up. And Texas is the first state in the country to be launching its own Ibogaine clinical research program, putting $50 million behind FDA-focused trials. I am hoping that this is the beginning of medicine finally admitting that maintenance forever can't be the highest vision that we have for human beings. Because if there is a substance that can help people break free from opioid addiction and not just survive it, then burying it isn't science, it's control.